start with the esophagus. First thing is, we are going to see what are the things we are going to learn in the esophagus. There we have the competency number 23.1, which is indicating we will be dealing with the external appearance, relations, blood supply, nerve supply of the esophagus and the applied aspects. First question is, what is the esophagus actually? Esophagus is a muscular tube which is extending from the lower part of the pharynx to the upper end of the stomach. Now, from where to where it is extending? That means what is the vertebral level of esophagus? For the vertebral level of esophagus, it is extending from C6 vertebrae to the T11 vertebrae. What is the length? Length is 25 centimeter. Now, what is this course of this esophagus? Esophagus, as we know, it is extending from the lower end of the esophagus, it is extending from the lower end of the pharynx. So that means it is passing through our superior mediastinum, passing through the posterior mediastinum, which we can see in this picture here. That we can see here. Here is it is starting in the neck. Here it is starting in the neck. One second. Okay, here we can see it is starting in the neck, through the neck, it is passing through the superior mediastinum, from superior mediastinum it is going to the posterior mediastinum, and ultimately it is going to end, while piercing the diaphragm, it will end into the stomach, at the upper end of the stomach. Now, what is the course which we already know now? This is a diagrammatic presentation which we can see here. That here is the esophagus, here is the trachea, here are the other structures which are coming across it. So that we can clearly see, here is the esophagus which is extending from the neck, passing from the neck, it is entering into our superior mediastinum, then posterior mediastinum, then ultimately it is piercing the diaphragm. After piercing the diaphragm, it is going to end at the upper end of the stomach. Now, so that means if we want to talk about according to the vertebral level, as we know already, it begins in the neck. What is the vertebral level? C6 vertebrae. Then it passes anterior to all the vertebral column. Apart from that, it is passing through our superior mediastinum, from superior mediastinum to the posterior mediastinum. From posterior mediastinum, it will pierce the diaphragm. Here important thing to keep in mind is at what level it is piercing the diaphragm. So at the level of T10, it is piercing the diaphragm, and it ends at the gastric cardiac orifice. That means vertebral level is T11. Okay. Now, in the esophagus, there we have the natural, some curvatures are there. What are these curvatures? We have the side to side curvatures as well as anterior posterior curvatures. Side to side curvatures means which are visible here in this diagram, which we can see here. Here is the esophagus, which we can see it is starting in the neck. Then we can see it is lifted, it is inclined towards the left side. After that, at the level of T5, it will come back in the midline. Apart from that, another curvature is there. That curvature will start at the level of T7 vertebrae. After the starting from the T7 vertebrae, it will go towards the left side before piercing the diaphragm. These are the two natural curvatures which we know, which comes as the side to side. That means whenever there is the curvature of the esophagus, curvature is always towards the left side. Then there we have the another curvature which is called our anterior-posterior curvature. What is this anterior-posterior curvature? It is nothing but it will follow the curvature of your vertebral column. So the same curvature which we can see here, here is our C6 vertebrae from where the esophagus is going to start, and we can see it is following the same curvature as like our vertebral column. Okay. Apart from that, there are the constrictions in the esophagus, means there are some parts of the esophagus where there we have the esophagus is narrow. There are some constrictions. So where are those constrictions? One thing is there, these constrictions we have to measure from your central incisor teeth. These distances are important for that. First constriction which we can see is at the beginning. That means which is formed by your cricopharyngeus muscle, which is at 15 centimeter from your incisor teeth. Apart from that, the second constriction is produced by your arch of aorta, which you can see here. Here is the arch of aorta. It is crossing this esophagus. While it crosses, it will give one constriction. It will put pressure there, so that one constriction is there, which is at the from the incisor teeth. The distance is 22.5 centimeter. Apart from that, the third this constriction which we can see is produced by the left principal bronchus here, which lies at the level of, or which we can say it is extended from the incisor teeth. Its level is 27.5 centimeter. Apart from that, the fourth constriction which we can see, fourth constriction is when it pierces the diaphragm, while at here that is 37.5 centimeter from the central incisor teeth. Now question is, why these constrictions are important for us? Why it is important? Because in clinical procedures for the endoscopy and the other things, we should know where are the natural constrictions of the esophagus. Apart from that, these constrictions are the natural site where the foreign bodies will get trapped. Okay. Now, what are the relations of this esophagus? What that means? What are the other structures which is present nearby to it? What are the relations? If we talk about anteriorly we can see here is the esophagus. In front of the esophagus, here is the trachea. That means trachea comes anteriorly. Apart from trachea, here comes your left principal bronchus, which comes anteriorly. Then our right pulmonary artery is there, which is coming anteriorly, and our arch of aorta is there, which is coming anteriorly. These are the anterior relation of our esophagus. Then if we want to see posteriorly what we can see? We can see here is the esophagus, and we can see it lies on the vertebrae, that means vertebral column. It lies in front of the vertebral column, and as we know, this vertebral column is covered by the prevertebral fascia. So our posterior relations are, here we have the vertebral column, then prevertebral fascia. Apart from that, from this descending through thoracic aorta, this right intercostal arteries are arising, which are crossing the vertebrae. So these are also coming as the relation of posterior relation of esophagus. Apart from that, this azygous vein is there, which comes posteriorly, plus the terminal part of this hemiazygous vein. All these structures will come posteriorly. These are the posterior relations. Then what are the right and left side relations? On the right side we have the right lung and the right pleura. On the left side we have the left lung and the left pleura. These are the relations. Here is again the diagram which is showing the relations. Here you can see, here is the your esophagus, which you can see here, and you can see this bronchus is, this left bronchus is crossing it here, and then here is our vertebral column. Then in front of the vertebral column we have the prevertebral fascia. Apart from that, here we have the azygous vein, and these all are our, this red color structure which is indicating that red color structure is our right posterior intercostal arteries. Apart from that, we can see the terminal part of the other veins which are draining into the azygous vein. That means here, there you can see your terminal part of hemiazygous vein also. Okay. And then posterior relation, again you can see posteriorly all these structures are present. Apart from that, posteriorly you can see when it near to the diaphragm here, this is our descending thoracic aorta. So this descending thoracic aorta is coming posterior to the esophagus. So that, but it is at the lower part of the esophagus only. Apart from that, come to the arterial supply. Now, as we know, this esophagus is extending from the root of the neck and it is reaching up to the abdominal cavity. So we divide this esophagus into three parts. The cervical part is there, that means the part which is present in the neck. Second part we have this the thoracic part, that means which is present in the thoracic cavity, and then the next part is the abdominal part which pierces the diaphragm. Okay. So out of these three parts, this thoracic part is the largest one and the abdominal part is the shortest one. Okay. Apart from that, come to the blood supply. What is the blood supply? In the cervical part, you can see here is the cervical part. From here, the one main artery which is going to supply is the inferior thyroid artery. This inferior thyroid artery is going to give the branches here, which we call it as esophageal branches. Okay, then come to the thoracic part. Near to the thoracic part, the largest venous channel, largest arterial channel which is present in the thoracic part, we know we have here is the descending thoracic aorta. So this descending thoracic aorta is also giving the branches to the esophagus, which we call it as esophageal branches of descending thoracic aorta. Apart from that, which we know when it is piercing the diaphragm, at which level it pierces the diaphragm? It pierces the level at the level of T10 and end at the level of T11. So that means here once it is crossing the diaphragm, this much portion which you are able to see, here is our this much portion which you are able to see, here is our this abdominal part. So what is the blood supply of the abdominal part? We can see from here, there you have the celiac trunk, from there one artery is coming which we call it as left gastric artery. So this left gastric artery will also give the esophageal branches. That means if we talk about the cervical part, in the cervical part we have the inferior thyroid artery which is supplying this. If we are coming to the middle part, that means thoracic part, for thoracic part, here we have our descending thoracic aorta which is giving the esophageal branches. Apart from that, the next one is our abdominal part. Abdominal part is getting the blood supply from the this left gastric artery. Okay, so that is all about the arterial supply. Apart from that, venous drainage. Venous drainage is almost same like the arterial supply. How? See, here again cervical part, thoracic part, abdominal part. Again cervical part, thoracic part and the abdominal part or the lower end, whatever. Here cervical part is supplied by inferior thyroid artery, and we know along with the arteries we have the veins of the similar name which are running opposite to the artery. So artery is coming like this, vein is going like this. So the vein which is going to drain is inferior thyroid vein. Then here thoracic part was supplied by our esophageal branches of descending thoracic aorta. That means here main arterial channel was descending thoracic aorta, and here main venous channel in the thoracic cavity is azygous veins. Okay, so that means the thoracic part is going to drain into the azygous veins, and to some extent hemiazygous vein, intercostal veins and bronchial veins are going to help in the venous drainage. Apart from that, abdominal part was supplied by the esophageal branches of left gastric artery. Similarly, lower part it is drained by the left gastric vein. Okay. Now come to the lymphatic drainage. What is there in the lymphatic drainage? Lymphatic drainage also we are going to divide into cervical part, thoracic part and abdominal part. So whatever are the nearby lymph nodes, they are going to drain the corresponding part of the esophagus. That means if we talk about the cervical part, in the cervical part obviously we have the deep cervical lymph nodes, the group of deep cervical lymph node. That means the upper parts or the cervical part is drained by the deep cervical lymph nodes. And thoracic part, as we know, thoracic part, in the thoracic cavity, so esophagus is passing through superior mediastinum, then posterior mediastinum mainly. So that means in the posterior mediastinum we have the posterior mediastinal lymph nodes which are going to drain it. Apart from that, third part is abdominal part. In the abdomen we have the left gastric lymph nodes which are going to drain it. Okay. Now come to the applied aspect of this. For the applied aspect, here we are able to see one term which is called achalasia cardia. That means the word achalasia word itself means difficult to relax. That means here is our normally, here is our esophagus, here is our diaphragm, it is piercing and continuing with the upper end of the stomach which is called the cardiac orifice. Now here is the condition which is called achalasia cardia. That means there is the the neuromuscular incoordination. Neuromuscular incoordination means when we are taking the bolus inside, then or the food inside, this lower end of this esophagus fails to relax. So this neuromuscular, that means reflex is there but muscle is not able to dilate, or the yeah. So that thing is called neuromuscular incoordination. So this condition is called neuromuscular incoordination or eclasia cardia, in which there the lower end of the esophagus fails to relax. Apart from that, here is another term, we call it as tracheoesophageal fistula. That means there is the abnormal communication between the two nearby tubes. Now what are these two nearby tubes? Name is tracheoesophageal fistula. That means there is the abnormal connection in between the trachea, which we can see here trachea and the esophagus. In between these two, during the development, there remains the connection in between these two tubes, which is called here tracheoesophageal fistula. Now, third one is the applied aspect which we can deal with this barium swallow, and barium swallow especially is done to see the enlargement of left atrium, because left atrium is present nearby to the esophagus. Apart from that, there is another term called esophageal varices. That means these veins are getting, or the esophageal veins related to this and lower end are dilated in the portal hypertension. So that this is the condition where you can see there is the portal hypertension and the veins are getting dilated. Apart from that, there is the hiatus hernia. That means in the hiatus hernia, the stomach can slip up into the thoracic cavity. Apart from that, here is the important question is vascular structures which can compress the esophagus. There is one congenital structure, that means that is your aberrant right subclavian artery. Apart from that, there is another condition which can develop, that is the aneurysm of arch of aorta. That means that there is the aneurysm is the ballooning of arch of aorta. So these are the things which is we should know about the esophagus.